Rabbit fever, also known as tularemia, is a serious infectious disease. It's caused by the bacterium. This bacterium is found in animals, especially rodents like rabbits and hares. Tularemia is a zoonotic disease. This means it can spread from animals to humans. It is important to be aware of the risks and how to protect yourself. Tularemia is more common in certain areas. These include the South, Central and Western United States. It is also found in some parts of Europe and Asia. The disease can occur at any time of the year, however it is most common in the summer months. This is when ticks and other insects are most active. Tularemia is a potentially life-threatening disease, however it is treatable with antibiotics. Early diagnosis and treatment are important for a good outcome. If you think you may have been exposed to tularemia, see your doctor right away. Certain groups of people are at higher risk of getting tularemia. Children between the ages of 5 and 9 are more likely to be exposed. This is because they often play outdoors and may come into contact with infected animals or ticks. Older men who work or hunt outdoors are also at increased risk. They may encounter infected animals more frequently. American Indians and Alaska Natives have a higher risk of tularemia. This may be due to their cultural practices, such as hunting and trapping. Living in areas where the bacteria are more common is another factor. It is important for these groups to be especially cautious. Tularemia can spread to humans in several ways. The most common route is through the bite of an infected tick. Ticks can pick up the bacteria by feeding on infected animals like rabbits, rodents, and deer. Direct contact with infected animals can also transmit the bacteria. This can happen during hunting, skinning, or cooking. The symptoms of tularemia can vary depending on how the bacteria enters the body. The most common form of tularemia is ulceroglandular tularemia. This type occurs after a tick bite or direct contact with infected animals. It causes a skin ulcer at the site of infection. This ulcer is usually painful and slow to heal. Swollen and painful lymph nodes are another characteristic symptom. Other forms of tularemia include glandular, typhoidal, pneumonic, and ocular glandular tularemia. Glandular tularemia is similar to ulceroglandular tularemia, but without the skin ulcer. Typhoidal tularemia affects the digestive system. It causes symptoms like fever, chills, headache, and diarrhea. Pneumonic tularemia affects the lungs and can cause pneumonia-like symptoms such as cough, chest pain, and difficulty breathing. Ocular glandular tularemia affects the eyes, causing pain, redness, and discharge. If tularemia is not treated, it can lead to serious complications. These complications can include meningitis, sepsis, and even death. Early diagnosis and treatment are crucial to prevent these complications. Tularemia is treatable with antibiotics. Several antibiotics are effective against. These include streptomycin, gentamicin, doxycycline, and ciprofloxacin. The choice of antibiotic will depend on the severity of the infection and the patient's individual circumstances. Treatment typically lasts for 10 to 21 days. Preventing tularemia involves avoiding contact with infected animals and ticks. When outdoors in areas where tularemia is present, wear long pants and sleeves. Tuck your pants into your socks or boots to create a barrier against ticks. Use insect repellent containing DEET on exposed skin and clothing. Check yourself, your children, and your pets for ticks after spending time outdoors. Remove any ticks promptly and safely. Be cautious when handling animals, especially rabbits, rodents, and deer. Wear gloves and protective clothing if you must handle these animals. Cook wild game thoroughly to kill any bacteria that may be present. Avoid drinking untreated water from streams or lakes as it may be contaminated with. In conclusion, tularemia is a serious but preventable disease. By understanding the risks, transmission methods, and prevention strategies, you can protect yourself and your loved ones from this potentially dangerous infection.